This is a video that describes how to make a training phantom to teach vascular access. It's really important that when we're learning procedural ultrasound that we practice on phantoms or models before we're released on patients. The following is a cheap and easy recipe that we've spent a long time developing, but it's remarkably simple and works very well. The equipment you need is some modelling balloons to make the vessels, a syringe filled with water and some food colouring for the blood, some chicken breasts for the phantom, and some cling film to wrap it all up in. You begin by making the blood, get your syringe with some water in, get a couple of drops of red food colouring, and hey presto, you've got some blood. The next step is to fill the vessels. I'm making a neck phantom here, so this is a carotid artery with a smaller lumen. Make sure that you fill the vessel and don't leave any air in it at all. Tie a knot in the top of the balloon, and how tight you make the balloon will change the appearance of the balloon in the phantom. If it's got lots of blood in it, it's tight, looking more like an artery. If it's not so tight, it looks more like a vein. Here I am making a slightly looser internal jugular vein, again expelling all the air. It's a larger diameter balloon, and there are our neck vessels. The next step is to make the phantom. Lay the vessels beside each other, sandwich them between two chicken breasts, wrap them up with the cling film, making sure you don't entrap any air between the cling film and the chicken. And there you have it, your phantom. Here it is, practice begins. This is my carotid sheath. On the far left you see my thyroid, this is my carotid artery, this is my internal jugular vein, this is sternocleidomastoid, and here it is in longitudinal section. This is our phantom. This is all the chicken breast, this is the smaller lumen balloon, this is the larger looser balloon which compresses when you press the transducer. Side by side, this is my neck compressing, this is the phantom. The settings on the ultrasound machine here are identical. So here we go. In transverse section, there are two ways of doing this, but in transverse section, watch the jiggling of the needle and the fanning of the transducer to follow the tip down until it hits the blood vessel that you're aiming for. You can also do it in longitudinal section. Many people prefer this. You can watch the needle as it goes forward and enters the blood vessel, and there you go, getting your blood flushing back. Here we are again in the transverse. Watch here to see the needle tip as you fan the transducer. You can just see the needle tip here coming towards this jugular vein and entering the vein. Again, here's the vein in transverse. Here you can see the needle tip all the time fanning the transducer to watch the tip as it comes down and enters the vein. In longitudinal, here you see the needle coming in. Watch it penetrate the vein, and then you can get your blood back, and there you are. Longitudinal approach. This is the needle with reverberation artifact behind. So that's how to make a vascular access training phantom. It's really useful. It lasts for between 20 and 50 uses, sometimes even more. It's clean and easy and cheap. If you want to learn how to do vascular access properly, come to ultrasoundvillage.com, do one of our courses.